My name is Angela McCabe. I'm a registered nurse, case manager. I've been with Access since 2013. I also have my bachelor's and my MBA. What are my functions with Access? I am a case manager, disease manager. I also am a manager within the department. I'm a co-manager with Cherie Serrano. We have a staff of about a dozen nurses right now, and we work with the field case managers, with the providers, with the health plans. We work to coordinate the care for all the Access patients, and for some health plans we're also delegated to work with them. Case management, it's really a collaborative effort where we do an assessment of the patient. We come up with a care plan where we've identified their needs. We work with the patient to develop that care plan, and then we work with them and we help facilitate good care for them. We want to get good quality care. We want it to be cost effective. We try to help them get from point A to point B in the most effective way to benefit good health. Disease management is usually more specific to a certain disease, like if they have diabetes, if they have COPD, if they have CHF, and then we're working just mainly with that disease to help them get healthier. How does our department assist the providers to get better outcomes? Thankfully, our providers are very aware of us, so they either email us or call us, and they tell us what they feel they need from us to assist their patient. Quite often, it's something as simple as bringing the patient in for appointments. They've missed their appointments. So we try to identify what's the issue. How do I fit into making things better for the patients and the providers? I think we really build a relationship of trust, number one, with the providers. It's funny, certain providers get to know particular case managers, so we all have different doctors that will reach out particularly to us because they've dealt with us before, they've had good outcomes, and they know that if they call me or they call one of the other case managers that they're more familiar with, they know they're going to get the assistance they need for their patient. I love that we can build up a relationship with the patient just by talking to them on the phone. It's amazing how close you can get to them and get to know them and their families. And I love that we can make a difference, because we have to know, a lot of times the patients will say to me, well, you know, I see my health plan will pay for a power wheelchair and I want one. You know, so we have to be aware of the LCDs and NCDs, because just because a health plan will pay for it doesn't mean the patient meets medical eligibility. And so we have to tactfully explain to the patient that they have to show medical need. Do I have any, as a case manager, any impact on hospital admissions and SNF and readmissions? We make a big impact with that. First of all, we have field staff in many of the local hospitals and SNFs, and we communicate with them constantly. If we know one of our patients has been admitted to the hospital and we know there's going to be discharge issues, let's say the patient lives alone, or they have self-care issues, we'll email the case manager that's in that hospital and give them a heads up that there's going to be some needs for this patient upon discharge. If they discharge a patient from one of these facilities where we have case managers and they see that the patient has refused to go to a rehab facility, and they insist on going home and they're worried about them, they give us a heads up, and then we call that patient the very day they're discharged or the very next day. We get them used to calling us before they decide to go to the hospital. Many of those patients, their primary care doctors will accommodate them for an immediate appointment. Rather than them going to the ER, it's more cost effective and it's better for the patient to go see their own physician who knows them. Utilization management is really where we try to find the most cost-effective quality care for the patient in the setting that's appropriate for the patient, and appropriate equipment. So the staff, we work with them. Most of them were case managers originally, and we're always talking with each other, going back and forth. What do you think would be best for this patient? They assist us a lot. Every day we are looking, first of all, with certain health plans, we get health risk assessments from them where the patient fills out, I think it's about a 12-page health risk assessment on all their medical history and their social history. What resources do we use to assist the patients? Gosh, we have a list. Some of the easy ones is Medicare Extra Help, or have them apply for Medicaid if they are in financial need. It's things that the patients don't know. You know, we have patients that they're at the point in their life where they can't live at home anymore, but they don't know the next step of how to go to an assisted living. What we try to do is just be their guide through the medical and social needs that they have.